Good afternoon, everyone. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to the second session of our five-part series on making the healthcare system work better for you. We are able to bring this important series to the community through the support of the California Healthcare Foundation. So a big thank you to the Healthcare Foundation for their support and partnership. And we are very fortunate to be a partner and collaborator with the Healthcare Foundation to implement one of the recommendations that came out of their Listening to Black Californians research project, which is a project to understand what happens when Black Californians interact with the healthcare system and what that experience is like for them. We are partnering with the foundation to elevate health education and health literacy through the How Do I campaign, which is an initiative to provide the knowledge, skills, tools, and resources to empower Black Californians to really take charge of their health and healthcare and own their power when they are interacting with the healthcare system. And so through the How Do I campaign, we at the California Black Health Network aim to ignite a Black health movement here in California and create a more empowered community of individuals who are more proactive about their overall health and well-being and focus more on prevention so that ultimately we can all do our part to improve health outcomes for our community and close the gap in life expectancy for Black Californians. And so today's session is about how do you communicate with your healthcare provider, really, no matter who or what type of provider you're dealing with. And so it's important to know and understand how to communicate effectively with your healthcare provider and your healthcare team so that you are seen and heard and ensure that you get the care that you need and so deserve. And also make sure that the healthcare system is more responsive to your needs. So we are delighted once again to have Dr. Glenda Newell-Harris, who is the author of Focus on Your Best Health, The Smart Guide to Healthcare You Deserve, be our speaker for today, as well as the remaining three sessions. But before we start, I'd like to cover just a few housekeeping rules. So we will hear from Dr. Glenda shortly, and that will be followed by a Q&A. So if you have any questions that you think of or want to ask, please make sure you put them in the Q&A box. If you want to give a shout out or say hello or make any comments in the chat box, that will be available for you to do so. If you want to tell us who you are and where you're from, that will be great too. But please do that in the chat box and make sure you put your questions in the Q&A box. And please note that everyone will remain muted throughout the duration of the session as well as off camera. And so before I introduce Dr. Newell-Harris, I'd like to just, for those of you who are not familiar with the California Black Health Network, I'd like to just share a little bit of information about who we are and what we do. And so we are the voice and trusted resource for Black health equity in California, and we are the only Black-led statewide organization dedicated to advancing health equity for all African Americans and Black immigrants here in California. We conduct outreach, education, advocacy, and policy work, as well as programmatic work to achieve health equity through the lens of understanding the critical issues that lie at the intersection of racial justice, social justice, and environmental justice. And so our vision is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we work to achieve and realize that vision every day through our mission, which is to ensure that all Black Californians, really, regardless of how well educated they are, how much money they make, where they live, who they love, how they identify, even where they're from, or even what their housing status is, has the opportunity to really access high quality and equitable primary as well as behavioral health care, and definitely avoid succumbing to diseases, and definitely those that are preventable. And so I would like to introduce our speaker for not only today, but the entire series. That is Dr. Glenda Newell-Harris. Dr. Newell-Harris is based in the Bay Area and is well known for her advocacy for all types of patients. And she'll tell you a little bit more about who she is and what she does. And you'll hear her perspective on how you, especially from a physician standpoint, can communicate more effectively with your healthcare provider as well as your healthcare team. But Dr. Newell-Harris is a distinguished physician, author, speaker, and patient advocate. With a career spanning decades, she has been on the forefront of addressing health disparities and championing equal access to high quality healthcare for everyone. She's a physician leader in internal medicine, a trusted voice and go-to expert for her patients, family, friends, and community around the world. She really is passionate about educating on issues around healthcare and healthcare advocacy. And her mission, her personal mission, is to empower those who can see things from both sides of the patient and provider relationship. So she'll talk a little bit about that today. So I won't go into much more without further delay. I'd like for us to hear more from her. So I will turn it over to Dr. Glenda to help us understand how we can more effectively communicate with our healthcare provider and what tips we can all take away from today to do that.
Wonderful. Thank you so much for that very generous introduction. I'm excited to be back today. Thank you to the California Black Health Network for this fabulous How Do I campaign. I'm so excited to be able to bring this information to you today. So without further ado, let's go ahead and let's jump right in. Next slide. So for the benefit, next slide, for the benefit of those that may not have been able to, okay, so that's all about me and you've heard that, and we can talk about that at another time, but let's talk a little bit about, let's recap from last time. So we had a lot of fun the last time we met last month, and we talked a little bit about patients' rights. So I want to just recap just very briefly today to remind you that you do have rights as a patient. Now, yes, we know you pay for your health premium, and yes, we know you feel like you're at the mercy of the medical facility, the healthcare plan, and the physician, but you have your own rights. And so let's just recap them very, very quickly. You have the right to have information brought to you in a clear format. You have the right to choose your own provider. You have a right to have access to emergency services, to participate in treatment decisions. And we talked a little bit about that last time and how that can be very complex. But there is a session where we will address more of that later on in the series. You have a right to be respected, and you have a right to not be discriminated against in the medical process. You have a right for your medical information to be kept confidential. You know, if your doctor happens to be your friend and you're socializing, you don't want your information discussed at a cocktail party. You have the right for that information to be kept confidential. And you also have a right to complain if you feel that your care is not appropriate or something that happened in your care is not appropriate. And then you have a right to appeal. And we didn't talk a lot about this last time, but I did mention to you that you have a right also to appeal decisions that are made at the insurance level. I actually had an experience with that myself. So if someone denies you a service through your insurance company, you have the right to question that and appeal. And I actually appealed something, and I took about 6 months, but I got a nice little fat check back in the mail for a test that I had to pay for, but after appeal, it was covered. And then finally, you have the right to take charge of your health in being responsible for the things that you need to be responsible for. And what is that? Taking the medications that are recommended for you, following the necessary guidelines, getting your tests done in a timely manner. So it is a two-way street. We'll talk a little bit today about how things are a two-way street. So that's a recap of our session from last time. So let's go on to today. So today we're going to talk about communication. You know, in our book, we talk about effective communication and savvy navigation leads to appropriate patient advocacy. We believe if you can communicate and if you can navigate, then you can advocate. So let's talk a little bit today about communication. So the first type of communication that I have listed here is verbal communication. Now that's the pretty obvious one where we just, you know, you have a conversation with the doctor, you tell your story, you tell them what happened. And this should be a time where really you've got the provider captured. They should be listening to you. You need to feel like they're listening to you, but there is an expectation that you communicate accurate information. It is so important that the information that you give to the doctor is accurate, because without accurate information, then you may not be led down the right path to determining what is wrong with you. I have had many situations where I'll have the husband and the wife in the office, and in communication, the doctor will say, well, has he been eating? And the husband will say, oh, yes, I eat every day. And the wife says he hadn't eaten anything for 3 days. It happens all the time. Now, sometimes it's in the eyes of the person. Perhaps the wife is more concerned than the husband about whatever the condition is. But it is very important. If you are not taking your meds, you need to tell us. Don't cheat, think we're not going to figure out, because we will, because we'll treat you with blood pressure medicine. You don't take them. You come in, we check your blood pressure. It's still high. And guess what? Then we think, maybe they need 2 medicines. And then you find yourself, in a situation where then you will possibly have a complication because, you may take one sometimes and then the other one all the time, and there's a problem. So verbal communication is critical. This is when you tell your story, you be factual. Now, from the doctor's perspective, you want your doctor, from a verbal perspective, to be asking you what we call open-ended questions. We really think it's best if the doctor will ask you more open-ended questions, because we generally can get more information from you that way. Now, sometimes it's necessary to have a question that's posed that has a true yes and no answer, but we really should be providing you with what's called open-ended questions. The other thing that's so important about poor communication, in particular verbal, is that we may miss a diagnosis as a medical provider, or your diagnosis may be delayed because we don't get the proper information that we need. And with inadequate information, then we really are having trouble putting a story together to figure it out. So if you look at this picture, you see that the doctor is engaged with the patient. It looks like whatever information she's sharing, the patient's really happy about it because she's got her hands clapped. Again, we're going to talk about nonverbal next. That nonverbal. So the doctor is engaging, is looking at the patient's looking at whatever this is, maybe lab results, and there seems like there's a very positive experience there. Let's go on to the next slide. Nonverbal communication. Now, this is where I'm sure all of you have been involved with nonverbal communication. Nonverbal communication happens all the time. And this is what many of us, we hear that, the doctor didn't seem to listen to me. Well, why is that? Because if the doctor's not looking you in the eye, there's some feeling that maybe he or she is distracted or not interested. So when a doctor doesn't look you in the eye, that's a problem. You want their undivided attention. And you can see in this photograph, the patient, again, these are all good stories here. The patient is smiling and the medical provider, and I'm not sure that this is a physician. I don't want to make any judgment issues here, but that's another conversation that you need to know who you're talking to. Often physicians will wear long white coats. I'll just give you a little tip on that. Usually if you see somebody in a long white coat, generally it's a physician, but many of our lab techs have been wearing long white coats as well. But the nonverbal communication, one of the things that we talk about in our book is that we addressed as it relates to nonverbal communication that's really not good, is something we call hand-on-door syndrome. Have you ever been to the doctor and you were in there with them for 10 minutes and all of a sudden you see the doctor sort of backing up to the door and stretching their arm out to grab the handle, and you're feeling like you're in the middle of the conversation, but it looks like your visit is over? We call that hand-on-door syndrome. And that is a nonverbal communication to a patient, I don't have any more time with you. And that's troubling because, when we come to the doctor, we come with our problems. You don't know that the appointments are often booked every 15 minutes or every 20 minutes. You haven't seen your doctor in 6 or 8 months. You've come with your list. You have all kinds of questions to ask. And I just say to you as an aside, if you do have that to happen to you, don't get upset or frustrated. It's not the doctor's fault that those patients are booked in there every 20 minutes. Because let me tell you, as I told you last time, there is a huge physician shortage. And so there are not enough of us to go around. And we do have nurse practitioners and physician assistants that step in, and they are providers as well. But the schedules are created for the providers to be super, super tight. And so if that happens to you, just schedule another appointment and let the doctor know that you have other questions that need to be addressed and there wasn't adequate time. But face-to-face, eye contact, looking at you engaged, Anything that is short of that is sending a different message. And it's often the nonverbal communication that makes a patient walk away and feel like, I don't know that I like that doctor. He or she just didn't seem to be interested in me. So nonverbal communication is very important. Next slide. Active listening. Now I'm going to say something that's really kind of, I'm sure all of you have experienced it, but if any of you have ever been in relationships, I'm not going to talk about one sex or the other, but if you've ever been in a relationship and you talk to your partner and you shared something that was just very meaningful and near and dear to your heart, and you get a like they didn't hear you or they didn't listen or they were distracted. So if you haven't, I have to tell you, I have. And it's important that when you are sharing information, in particular in something like this, that the provider is what we call actively listening. You look at this doctor's face. This doctor is engaged. He is looking at the patient. He has a very serious look on his face because I'm thinking that she may be sharing something that is very personal, very near and dear. When patients go to the doctor, they have held information back from everybody else for so long. You see people, how you doing? Fine. How you doing? Fine. But then finally, when they get in that doctor's office, it's that private place where they can share it, where they know it's not going to be told. And so they are looking for an attentive ear, a caring face, someone that looks like they really want to hear this message. And so this is what we call active listening. The provider's not saying a word, but it's all in his face. He is completely engaged with that patient. Now, I'll just pause here and say a little of this was lost during COVID because, if you've ever been in a situation where you tried to have an active listening conversation with someone and you're wearing a mask, then all you have are the eyes. And I've actually been in situations like that. And really, all you have are the eyes, whether the eyes or the eyebrows go up or down, or whether there's a serious look. That's all you've got when people are masked up. So sometimes we have to just laser focus in on those eyes to just get that feeling that the provider is really right there with you while you're telling that story. Next slide. Written and electronic communication. Okay, so this comes to you in all fashions and formats. Right now, every medical system and program has electronic medical records. So I'll just speak to you on right now, initially, on the whole notion of electronic medical records. So all of you, if you haven't, should get your electronic medical record app so that you have it on your phone, so that when information comes to you from your doctor's office, you are able to read that information real time. If you are having trouble and don't know how to download that app, go find one of your Gen X or millennial kids or grandkids or coworkers. They would love to help you figure out how to download that app. That is a must. You need to do that because that's where the information is going to get dropped in. That's a significant part of your written communication. And they put all kinds of things in there. And this is the troubling part about this written communication, folks. Now, I want to take a pause here again on this. Because of the laws that were created some years ago, we as physicians are no longer allowed to withhold medical information from you, in particular testing. So now when you put that app on your phone, be prepared that some lab results and tests are going to get dropped in there before your doctor ever sees them. So you have to brace yourself when you tap that button to open up that app, because sometimes it's good news and sometimes it says abnormal. So you got to be prepared. So brace yourself for it. Be prepared. If you want to know the knowledge, you got to know how to be able to take all that. So usually when the doctor finds out and gets the information, they get it usually the same time you get it. So sometimes the notes will come before. I had some information come in and it was interesting. And the information was good news, but of course it was a very complex test and it dropped in and I had two messages. One message was from the person telling me what the results were. The other one was the test itself. I didn't know which one to click on first. I clicked on the first one that was easy. As it turned out, it was the test result that was mass confusion. And I'm a medical doctor. I mean, it had so many lines on it and so much stuff on it. And I said, oh, mercy, can I just get to the bottom? Is there negative here somewhere? And then when I clicked on the next message, it said, good news. So that's something else you have to be prepared for. That's all in your written communication. So get that app and review it. Now, here's the other thing. You get something called post-visit summaries from your doctors and your nurse practitioners and from your visits. And they will hand them to you, but they also are dropped into your app. Read those summaries. I've actually had some family members and clients to say, well, there were things that were put in my summary that they said that they did for me or to me. It never happened. So again, remember, we told you in the patient's rights, you have the right to get information in your medical record corrected. So if the doctor told you, to walk 5 miles a day and take this medicine 4 times a day and, whatever, and you didn't understand it that way, then you want to get that adjusted or corrected. Maybe it was an error. There are also aspects of your chart from the doctor writing into your chart that are in the app. And I have actually had colleagues and clients to tell me that a doctor or provider wrote in the chart, patient refused, when the patient didn't refuse. The patient was offered 2 appointments. One appointment was in January and the next appointment was in February. So the patient was unable to attend the January appointment because of conflicts, but could attend the February appointment. And rather than the message saying patient's preference for appointments was February due to travel, and they will put that in there because sometimes they don't want to indicate that they've delayed your visit, when in fact the person just simply said, that date doesn't work for me, this other date does, but it was written in the chart as the patient refused. So read your charts, take some time. And, there are many sections. There are lab sections. There are message sections where your provider will send you a message. There's a section there on how to set up an appointment. There are many, many sections of your chart. You want to take a look at your chart. Now, that's part of written communication. The other thing with written communication, you can book an appointment from a written communication perspective because you can also do that right within the app. So everything now is electronic. Everything is written. There's very little that is on paper anymore. And so keep in mind that the written information in your record is what is there that stays and is the information that is shared. Now, speaking of shared information, if you are seeing all doctors in the same network, then generally speaking, your doctor will be able to go into the electronic medical record and your gastroenterologist will know what your cardiologist has done and your primary care doctor will know what your neurologist has done. But if you are seeing doctors that are not in that network, that information will not be in that electronic medical record. So you might go see your primary care doctor and you've been given some medicine by your neurologist. And you'll want to know, well, why doesn't the primary care doctor know that I'm taking this medicine because I just saw the doctor, 3 days ago? Well, if they are not in the same network, then that doctor doesn't have access to that, which leads to the importance of you bringing all your information with you to the doctor. And that's why often when you go in for a visit, the medical assistant will spend all that time going over your medications with you and your medical problems with you, because they're doing their best to try to consolidate and get absolutely everything into the record that they can. Next slide. So how to interact with your doctor. I think one of the most important things about your health journey is really feeling like you have a decent relationship. And I'm going to say with your primary care doctor, you really need to have a good relationship with all your doctors. I mean, as we all get a certain age, we're going to all have, all those doctor's appointments. It will no longer be, just your GYN appointment and see the dermatologist, to get that acne taken care of. If you live long enough, you're going to have a cardiologist. You may have a pulmonologist. You may have an oncologist. You may have a neurologist. You're going to have lots of them. So it's hopeful that you will have good relationships with all of them. But it is important that you recognize that this relationship with the doctor is a two-way street. There's information that you have that you need to give, and there's information that they have that they need to give. Now, it's a little bit of an extraordinary situation because, usually when you start sitting down telling everybody the most intricate things about your life, you've known them for probably 5 or 10 years. But in this situation, you have to kind of get to meet somebody in 10 minutes and they ask you the most intricate and intimate things. I often say to people, when I ask people, how are you still sexually active? And when you say that to people that are non-medical, they're like, wow, you ask people that? Yeah, I do, because that's part of the medical history. And the expectation is, and they're supposed to tell you, well, yeah, because it's really not personal, but from the standpoint of that, but it's important. That's just as much a part of my medical history is knowing what your drug allergies are, of knowing what medications you take, of knowing whether you're married or single or whether you have children. All of this is part of the armamentarium that we take in as physicians to be able to really feel like we understand and get to know the patient. But at the same time, you're interviewing us. And so you might say, well, what kind of questions would I ask my doctor? Well, first of all, there's got to be some chemistry. And so the first thing you're probably going to notice is, well, are they even looking at me? Do they have eye contact? Do they feel like they're comfortable with me in the room? Do they seem rushed and hurried? Because if all that happens in the beginning, you probably aren't even interested in continuing that relationship. But if it's good, then you're going to want to get involved. And so just like they ask you questions, there's nothing wrong with you asking them questions if you haven't already looked it up online, because with these young people, they check everything online. They check the Yelp reviews and they go to people. Yeah, these 5 people said this person was great with this, that, or the other. They said he or she was late all the time. But once you got into that visit, you got that doctor all the way. So you might ask them, well, doctor, where are you from? You may find that you and the doctor are from the same hometown, the same state, or where did you finish your medical training? There's nothing wrong with asking that. Or where did you go to medical school? Often they're just conversation starters, things to get you engaged with the doctor. You might then want to, just sort of ask the doctor, well, have you seen this kind of thing before that I'm coming in to talk to you about? How often do you see this? Am I crazy? It's okay to ask the doctor that. And one of the things that I really always love to tell people is if you're about to have a procedure of some sort with a provider, neurosurgery or something along that line, or having a coronary artery bypass graft. I tell this to people all the time and I do it myself. There's nothing wrong with asking the doctors, how many of these coronary artery bypass graft surgeries have you done in your career? You want somebody that's done, several hundred, not somebody that can say, oh, I've done 50 in my career and they've been at it for 30 years. I had a friend that had a thyroid condition. And I had this conversation with her over 10 years ago, and I ran into her this summer, and she was telling me the story. She said, I had this thyroid condition. You remember you came to me and I told you I was going to have my thyroid removed, and you told me that I need to go back and ask that doctor how many thyroidectomies. That means removal of the thyroid. Ectomy means removal of, to take out, and it was a thyroid. And well, I said, yeah, I did tell you that because that's kind of my story. And part of the reason for that is there is a very, very small but very, very important nerve that runs in between the thyroid gland. It's called a recurrent laryngeal nerve, and it controls your voice box. So can you imagine going in for thyroid surgery and then hardly being able to talk? So I want to make sure my head and neck surgeon knows where that recurrent laryngeal nerve is. And if he's done several hundred, he knows where to find it. And sometimes nerves are not always in the same place in every person. So, it's sort of my story when I get on airplanes. And this is nothing against young people, but I have had, honestly, a fear of flying over my lifespan career. And now part of my job is to fly. So I had to kind of get over that. So God and I have an understanding, you know, hoping that nobody on my plane is supposed to be meeting him any sooner than I'm supposed to be meeting him. So I've had to just sort of accept the fact, okay, well, you know, here I am. But my position on this is that, you know, I want this case that where I'm going in, I want you to be fully alert. I want you to be prepared for this. I want you to know that, you know, I'm looking to look at you when this is over and everything needs to be good. And your spouse or children are also there. So, you know, it's kind of like I've got high expectations for you. It's what I say to the pilots. I love them when they get on and they have gray hair because I feel like they've been in some stuff with the gray hair. They've been in some turbulence before and they've learned how to get out of it, or they've had some situations and this is no big deal. I love it when the pilot comes on and says, ladies and gentlemen, you know, about 5 miles up, you know, we're going to be coming into a little bit of turbulence. Everybody take your seats. You know, I'm going to ask the flight attendants to not move around. I love that. But when I hit turbulence and there's nothing coming out of the cockpit, I'm like, oh Lord, what's getting ready to happen? And so that's what you want for your doctor. Things will happen in your situation, but it's a beautiful thing when the doctor says, yeah, we might have a little bump in this road, but I can help you handle that. We'll get past this. Yeah, we've got something we can treat you with for that. So it's all in that engagement. You have to be able to engage, and that doesn't happen, you know, with a one-off. For those of the people that are young, you're not going to have intimate relationships with your doctors, and that's a good thing. Just go once a year. But as you get more and more senior, you'll have more engagements and you'll be able to build that relationship. So interacting with your doctor is a two-way street. It's okay to ask them questions as they ask you questions. Next slide. What's culture got to do with it? Well, it has everything to do with it. And that's also part of you having that feeling about that this doctor is clicking for you. It's important that you share your social history, cultural, and religious practices. There is a situation that we discuss in our book where I want to look at my time, make sure I'm okay. All right. We talk in our book about a lady that had high blood pressure, and she had been prescribed a diuretic. And her doctor's appointments tended to be on Mondays. And when she'd go to the doctor on Mondays, her blood pressure was always high. And so the doctor just couldn't figure it out because she was taking blood pressures at home and her blood pressure readings at home seemed to be okay. But when she'd come in on Mondays for these blood pressure checks, they were high. So finally one day, the patient just said, doctor, I'm an usher at my church. And when I'm up ushering, I can't be going to the bathroom every 30 minutes. So I don't take my blood pressure medicines on Sundays, which helped to support, defend, and justify why her blood pressure was always elevated on Mondays. Well, in that particular situation, the doctor then had an option to consider a different type of medication for her because perhaps a diuretic was not going to be something that would work. If you have a job where you can't get to the bathroom, we need to be thinking about that. Similarly, there are people that practice religions where Ramadan, where they don't eat until after sun goes down. Well, the doctor needs to work with you on that. The doctor shouldn't say, oh, well, you're Muslim and you deal with Ramadan and I don't know how to manage your diabetes. If you have to work with the doctor on that. And if the doctor's not willing to work with you, then that's when you might begin to start looking around to see if there might be other people that might be more understanding and appreciative of your situation. I have to tell you, doctors, when they take us in, we're all individuals. Let's just say you're a television person. You may be a television person, and these folks that are on television, it's my understanding that they're critiqued all the time. So a little pimple right here or a rash right here, a huge deal for a newscaster. No big deal for me. I can just not show my camera. And so those are people that might just have to rush in to get something urgently because that's a doctor understanding your culture and your practice. Now, you can't do that every week, but maybe you can talk to the doctor about, well, give me something that I can have, that I can rub on this or fix this so that I can just, you know, maybe makeup will cover it. But the doctor, again, needs to understand your social, cultural, and religious practices, and they need to honor them. And they need to respect them and respect your desire to want to continue with those social and religious and cultural practices as you continue to take care of yourself and take charge of your health. Let's go on to the next slide. Oh, this is one of my favorites. Say what? Look out for medical jargon. So this is here. I'm going to let this sit here for a minute, and I'm going to try to go through each one of these things. So the message here is, please don't allow the doctor or nurse practitioner or physician assistant, I should just say provider, don't let them speak in jargon to you. Just don't let it happen. And I will tell you, as having been in this business for so long, it becomes a habit. We talk to each other as medical providers that way. And, I know you all have heard this term about code switching. So that's not new to those of you, I think, on this call. We must code switch as medical providers and understand that we need to be speaking in a way that people can understand at all times. And we're all guilty. We forget. And all you need to do is just say, doctor, I don't know what ATP means. Can you tell me what that means? I don't know what you mean by, here's one, NPO. What does that mean, NPO? So it's okay to have the doctor or nurse practitioner pause and explain it to you. So we will say things like, oh, the so-and-so and so-and-so is impressive. Well, you would think that that's a good thing, but no, that's not a good thing. Because maybe when we're examining your liver, we determine that your liver is big, and we might say, oh, it's an impressive liver, but that's not a good thing. Progressing, you might think that means it's advancing and getting better. No, it means it's getting worse. Another one that we've just mentioned, NPO. That's Latin. I don't remember Latin today, but it's no eating or drinking. And that means no coffee. And unless the doctor tells you no water, it means nothing, ladies and gentlemen, nothing. I have so many people that say, oh yeah, the doctor told me not to eat or drink anything, but I know I can have my coffee. Or I'm just drinking a little bit of, and sometimes water is okay. But in certain situations, when they say NPO, nothing by mouth, that's exactly what we mean, nothing by mouth. The next one, unremarkable. That means it's good. Positive nodes. That means that the cancer has spread. And we're looking at nodes because we're looking that's where cancer goes. It goes to the lymph nodes. So you might hear positive, thinking that that's something that is a good thing. Negative test. And this says no cancer, but negative test can mean anything. All kinds of tests are negative. Negative for having a high cholesterol, or negative for having congestive heart failure, or HIV tests can be negative. So negative generally is a good thing. Grossly intact is another terminology that we use, but that's usually when we're describing parts of the body. So you really shouldn't ever hear us say something like grossly intact. And then febrile. Febrile means that you have a fever. We often say that a patient is afebrile, and that means that there is no fever. So, just like the mechanic has a language, just like the finance people have a language and the engineers have a language, we have one too. But just like they speak the way that they speak, I say the same thing to all of those that I just mentioned to you. Break it down for me, because I don't know exactly what you're talking about. And it's absolutely okay to raise that as a question. A doctor, a nurse practitioner should never speak to you in that type of language. Next slide. Technology and medicine. So I'm going to move quickly on through this. Technology and medicine, that's kind of the newest thing going on right now. You're hearing about telehealth visits, and everybody's so excited. Oh, I can sit in my living room or my bedroom, and I can see my doctor, and I can engage. I can be in China and talking to my doctor in Oakland. So that is a tremendous advance, the technology. But I also want to caution you that it is not the panacea. I actually remember during COVID that I had colleagues and family members that were seeing their doctors through telemed, but they were cardiologists. So how can you really tell me what's going on with my heart if you don't listen to it? Now, I'll tell you a little secret. There are things called peripherals that can be purchased, and they are attached to the computer. And then you have to have something on the other side where you are. And then the doctor can, honestly, technology is such that you can be in China and your doctor can be in Oakland and they can listen to your heart. But the peripherals have to have been purchased and you have to have something on both sides. They can look into your ears through technology. But what I found during COVID was nobody had the peripherals because guess what? They cost a lot of money. So people were seeing people just like I'm talking to you. They were just seeing people and, there were no vital signs being checked. Doctors come on the screen, you come on the screen. How you doing, Johnny? Oh, I'm good. You had any more chest pain? No. Your medicine working out? Okay. You get tired going up and down steps? Oh, not anymore. Doctor, I'm good. Visit over, charge the same amount of money. Not one vital sign checked, not one heart examined. So sometimes when it's offered to you in your visit, oh, would you like to see your doctor virtually? For certain things you can. But please don't allow technology to allow you to feel like, oh, well, they're offering it to me, so it must be okay. There are some times when you need to go to that doctor's office, sit on that table, and let somebody touch you and put instruments in your ear, listen to your heart and lungs, check your reflexes, and many other things that we do in an examination. So just keep in mind, technology is here, but it should not ever completely replace the kind of healthcare, the touching, the feeling, and the engagement that happens when you are in the provider's office. Next slide. So let's talk a little bit about a few things to just keep in mind as a list. At the end of each one of the chapters in our book, we have some tips. And so I've included these tips in this last portion of the presentation of things that are really, really important. I want you to remember as you are communicating and making certain that the communication aspect of your visit is the best kind. Number one, fill out all medical forms completely and accurately. Now, it used to be that you'd go into the doctor's office and they'd hand them to you when you walked in. So let me tell you, if you go to the doctor's office and they're handing them to you when you walk in, then that probably means that you may have had 99 chances out of 100, those forms were dropped into your app. You could have answered them from home. And then when you walk in, all the information's already there. So you get a second chance on that. So because sometimes they will bombard you with so many forms, you're like, oh my goodness, I don't have time to fill all this out. I'm going to be late. So check your app to see if forms are there and make sure you fill them out completely and accurately. Number two, prepare your questions prior to your doctor visit. Remember, this is your precious time with your provider. And, doctors that have been around for a while, you can't pick up the phone and get them right away within 2 weeks. So, you may not be able to see that doctor for a while. So prepare your questions and then put them in priority so that if you run out of time, you've got the most important ones answered first. Number three, if language is a barrier, request a medical interpreter. That should happen. And, honestly, it shouldn't be your children. There are many things that are in your medical history you may not want your children interpreting for you for your doctor visit. So connect with the doctor's office in advance and find out. Most doctors have something called a medical interpretation line, and you can get on the phone with someone and they will be able to translate for you and your family and your loved one. Number four, be concise in sharing your medical history. Do understand that the doctor doesn't need the long version of your story. They need the shorter version. And the shorter version should include things like, I checked my blood pressure and it was so-and-so and so-and-so. I checked it 3 days last week. I checked it in the morning when I got up. I checked it in the evening. I have not been taking my meds, but despite that, my blood pressure was such and such. And since I was doing this, that, and the other, I've had this or that happen. Get right to the facts and give the doctor the basic information, because from what you've given the doctor, they will be able to decide what additional questions they need. And if anything that you've shared is not clear or confusing, then they can come back and ask you those questions. Number five, bring all your medications to your visit. Now, if you don't want to do that, then just write the names down. In fact, you should have the names of all of your medicines written down on some little card and stick it in your wallet. Because if you fly somewhere and you leave your medicine at home, you don't want to go to the pharmacy and say, well, I take a little yellow pill for blood pressure and it's got an X on the back of it. You want to be able to say, I take lisinopril 10 milligrams and I need 3 of them. Or, I'm going to be on this trip for 3 days. Sometimes the pharmacist will handle that for you without speaking to your doctor if it's for sure, if you're registered there, if it's like a Walgreens or a CVS and you're in the system and you explain that you left it. Sometimes you will have to call your doctor to get that prescription called in, but many times not. Next slide. Review new medications with your doctor. Be very clear about the directions that you've been given about your medications, and then ask your doctor if there's some side effects you should be expecting. Now that comes with its challenges. I have to tell you, whenever I get information like that, I always go on the bad side. I just hear all the horrible things. Oh, well, it could cause this and this, and I'm thinking, oh Lord, do I want to take this? But they do have an obligation to let you know all of the side effects. And sometimes you can be given a medication and there are no side effects. But be sure to review new medications with your doctor. And then it doesn't harm you to ask the doctor, are you sure there are no problems with drug-drug interaction with the medicines I'm already on and the medicines that you have given me? Now, the pharmacist should pick that up when it goes in. If there are drug-drug interactions that aren't good, that should be picked up, but it's okay to ask. Pay attention to body language. Listen carefully and take notes in your visits. If you think that you're going to be getting some information back on tests that you think is going to be startling, bring someone with you. Review your electronic medical record after every visit. We've talked about that. And then update your personal health record regularly. You will be given that opportunity when you go in to see the doctor. Next slide. I think we're almost at the end. Things to remember. Effective communication, as we discussed, verbal, nonverbal, active listening, and written and electronic. Overcoming barriers. Preparation for mutual understanding, and that's that two-way street in getting to know the doctor. Share your cultural, social, and religious context with the doctor so that your visits can be caring and sensitive. And insist on no jargon. I think that ends everything. Thank you so much. Next slide. Yes, thank you. Thank you so much. That ends our presentation for today.
Thank you, Dr. Glenda. We do have a couple of questions in the Q&A box. I'll let you know what they are in just a second. Let's see here. Yes, so one person wants to know, how do you get things corrected and or taken out of your chart?
Well, here's what I would do. I have to tell you, I've never had this happen to me, but what I would do is when you're at an appointment, you've got the summary there. If there's information that you have to address it with the doctor that wrote it. So, just in a casual visit, you just say, well, it was mentioned in the visit that, it's probably hard to get somebody to take out patient refused. Don't worry about that kind of stuff. Actually, I have to tell you, we are criticized as physicians when we make these blanket statements about a patient is non-compliant. We're not even supposed to say that anymore. Because if you're not taking your medicines, there may be a reason why you're not taking the medicine. So we are kind of more corrected on that. But I would say to you, just have a little nice conversation with the doctor. But remember, you got to put a lot of sugar with this. It's a person that's taking care of you. You don't want to make them mad. And at the end of the day, if that's the only thing they've done wrong and they brought you over a whole lot of mountains, I don't know, you may not even want to address it. But if it's something that you really feel strongly about, just say, I noticed in the visit summary that it said so-and-so, but I don't remember getting that information from you. That's one way of doing it. But I would do it always with kindness and professionalism.
Great. Next question is, how does the patient know what language to use to get the information that makes you feel comfortable? For example, you just mentioned the current can you pronounce that for me?
Recurrent laryngeal nerve, yes.
Thank you. Thank you very much for that. And you explained the suffix ectomy, meaning to cut out or removal. As part of our patient rights, how much medical language do patients need to have to talk to a clinician? Is there too much misused medical language that a patient can try to use that might offend the clinician rather than increase the information flow?
Well, I'm going to say that, each one of you has your own career path. And if I dare walked into a television production, I wouldn't know anything from anything. So I think it's important really that providers respect that everybody has their own special area. But having said all that, um, I don't think you need to be sitting around learning medical terminology. You need to be focusing on whatever the issue is that you have, taking an accurate history so that you can be factual with the doctor to say, well, this has been going on for 2 weeks, or this has been going on for 3 months, and doing things like take your temperature, objective things. I will tell you though, that a shameless plug, we do have a glossary in the back of our book, and we created it that way because we know that patients want to learn and they want to have information. But, like I said, ectomy means remove. Itis means inflammation of. So there are certain things that you can learn that may make you feel more comfortable, but no, you should not spend your time learning medical terminology just to have a relationship with your provider.
Great. And the next question is, what has been your experience with lisinopril and African Americans? Any negative correlation?
I was just reading an article about this, that lisinopril may not be considered one of the primary drugs that's recommended for African American patients. Um, so I have used lisinopril a lot in all races of patients. I have had patients that have developed the angioedema that you see, the swelling of the lips and so forth, the allergic reaction. I have seen that and have had to take patients off of that, and have had family members on that medicine and had to take patients off of that. I guess I'll just have to say that caring for a patient is just very individual. I love hearing things like, we think these medicines are better in African American patients. Well, let me say, I used to love hearing that because it made me feel like we were studied. But let me tell you, ladies and gentlemen, we are a melting pot of people. Everybody is cross marrying right now. I mean, Blacks are marrying whites, and whites are marrying Indians, and Chinese people are marrying Koreans, and, Pakistanians are marrying. So, to say that this is good in African American people, sometimes those medicines are good in African Americans and sometimes they're not. So my experience with lisinopril, to answer, has been a good experience for patients. But in general, if a medicine is given to you and it's not working for whatever it is, then you let the doctor know and another medication should be chosen.
Great. Next question is, sometimes you don't know what you don't know. So how can you ask questions when you don't even know what to ask, or especially if this is a new condition or disease that you have minimal understanding of?
Great question. So if you're anything like my kids, they go to the internet, they get everything from the internet, then they come to me. So, there's a lot of information out here. I recommend folks go to the CDC for information. I don't think it's a problem going out to trusted sources to get information. And I mean what I say when I say trusted sources. So if the doctor gives you a diagnosis of something, first of all, many of the medical conditions that are around, there are a lot of support groups. So you can find out about support groups and engage in support groups, and many times you can get resources there. But you can go online there's WebMD, and I get nothing from this, but we use something called Up to Date, and that's a prescription that we pay for several $100s a year, and tells us very much what the latest and the greatest is about medical conditions. But, if you're diagnosed with hypertension, I mean, you can go to the NIH or the CDC and get all kind of information. If you, however, are diagnosed with an unusual disease, such as sarcoidosis, which is seen in African Americans more frequently than not, or things like lupus, or, unusual types of diseases, you can really Google those and read whatever you can read. And then if there's information there, take that information and go back to your doctor and say, well, I read somewhere that such and such and such, is supposed to happen to me with this condition. So, you do have to do a little bit of reading. And from there, ask your questions, even if you need to just get them confirmed. But do understand, if you do end up with a medical condition that is new, It's not your responsibility to figure it out. It's your doctor's responsibility to figure it out. It's your doctor's responsibility to provide you with the resources that you need, whether it's social work, whether it's seeing a mental health counselor, to help you process and deal with this new diagnosis, to help you be able to understand, okay, how am I going to navigate this now that I have this?
Great. I'm happy to see there's a lot of questions in the Q&A box today. So thank you all for putting your questions here and for having a lot of questions for Dr. Glenda today. So the next one is, are there any tips for families who have loved ones dealing with early stages of dementia, what presents as dementia, but loved one is in denial and won't discuss it with the doctor, but the family feels like the doctor should be aware. Often the family can't speak with the doctor without the patient's consent. So how can their concerns be relayed? Concerns about driving, financial management, general safety, and so on.
Yes, I understand that. I would say to you, if this was your loved one, here's what I would do. If you can, if your loved one is in the same community, go to the doctor's appointment with your loved one. Be there so that the doctor knows, I'm Johnny, I'm the son, or I'm Mary, I'm the daughter. That is in some way establishing that relationship with that doctor to put a name to a face, if you can. Sometimes we can't because our parents live in different places than where we live. But I will tell you this. I would be very, very surprised if you called in to Dr. Smith's office and represented yourself as Mary Jones's daughter, and you'd like to leave a message for Dr. Smith to say just what you said. We deal with this all the time. My mother needs her license taken away, Dr. Smith. She can't do blah, 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 blah. My mother is having such and such and such. Could you please on the next visit, do what you could to address, whatever testing you can do for mental health? I don't think a doctor is going to turn away. They're not going to be able to tell you about your mother's health, but I would be surprised if they shunned your willingness to give the doctor, because we rely on everybody in the family. Now, in order for that doctor to talk back to you about your mom or dad or whomever, then she's got to write your name in the chart to say it's okay to have conversations with. And we talked about that last time. But that information we as doctors are often looking for. We want somebody else, because we're seeing it in the office and they're coming in with keys and they're 98. I mean, my mother's 106 and she was driving up to 99. And my sister and I were like, oh, mercy. Who's going to take the keys away? But fortunately or unfortunately, she had a little minor accident and she figured it out. She knew we were coming after her. So she surrendered everything at that point. So you keep trying to talk to the doctor. I don't think the doctor will turn you away.
Okay, great. The next question is, what about questions you don't know how to ask? This is kind of similar to a question asked previously, but this person's son was an athlete, super lean and healthy looking, and no one checked his heart. It was enlarged. And I think that there may have been a bad outcome for their son in this situation. So I'm sure you've heard of stories where people who seem to be strong and physically fit end up collapsing on the basketball court or playing football, but have no prior history of heart conditions or diseases, and unfortunately becomes a fatality.
Yeah, that's a great question. We do hear about these conditions, and some of these conditions that happen are conditions that are unavoidable. Some are, but some of the conditions are, you can't avoid them. I once told a friend of mine that's a school principal, that I wondered if all of her, young basketball players all needed to have echocardiograms before they ever went out on the basketball court. And this is a K-8. So we're talking about like 6th, 7th, and 8th graders. I think you just posed the question to the physician. How do I know that my son doesn't have heart disease? He's an athlete. And, the doctor may come back and say, well, I don't hear a heart murmur. And, but as I said, there are some conditions we cannot test for. But if it's a muscle related issue or a valve related issue that can be picked up on echocardiogram. If they hear a murmur, they can order it. But, I'll tell you what I would do if it was my child. I'd say, could you please order it? And if the insurance company won't pay, I'll pay the $275.
Yes, it's
That's what
better to be safe than sorry. Yes.
I would.
Okay, so we do have a few more questions. I'd like to get through all of them, Dr. Glenda, if you have some time, and also
I'm good. I'm good right now.
Right. So the next question is, can you provide next steps for someone who continues to have health or medical equipment services handed off to another provider? For example, the patient has required durable medical equipment that is included in benefits, but patient is told to follow up with another specialist or do the work when the provider could put in an authorization to help save that patient time and time in general.
So I'm wondering if the other person, that's an interesting question. Um, well, I tell you what I would do. I'd talk to the office staff. I'm giving you guys all of my secrets. Get to know the staff. That's a whole nother discussion. When I had some family issues with my family members, my sister and I used to roll up into the hospital with bagels and donuts for everybody. Every morning, the family member was in the hospital. And you know what? That family member got good care. So, it's good to make friends with the people in the office. Sometimes that nurse or medical assistant might be able to kind of steer you in a direction to figure out how to do it. Sometimes people need social workers. And sometimes it's just too much and the information is insurmountable. The child's not there, the parent can't figure it out. So I would start there. But the bottom line in terms of durable medical equipment and anything that a patient needs, that needs to start with your primary. Even if the things are being ordered by a specialist, if you can't get help from the specialist office, go back to your primary and ask the primary to help you figure out a way, because sometimes this filling out things is very complicated. But start with your primary care provider.
Great. And this next question is from a person who says their doctor is saying that long COVID is just something to deal with. Is there any new research on what to do post-COVID if you have long COVID? Since it seems like COVID isn't going away really completely anytime soon.
Great question. I am just coming off of the National Medical Association meeting where we talked a little bit about long COVID there. The short answer to the question is no, there is no medication that is made available. The doctors are still trying to figure out long COVID. Long COVID comes in so many different varieties and shapes and sizes, and it's just so incredibly variable. They can't get their hands wrapped around it. The one thing, the take-home message for me from the NMA was, you don't want to get COVID. Now, many of us have had it, and we've gotten through, and we're back to our routine. But as was said by one of the speakers, many people say, oh, I'll just go ahead and just get COVID. Then I can be off of work for 2 or 3 days and then I don't have to do this and the other. But you don't know if you're going to be one of those individuals that gets long COVID. So we don't know. And let me just say to everybody that's hearing me today, there is a huge COVID surge right now going on. Put your mask back on. Wear it to the grocery stores, wear it on the airplanes, wear it anywhere where you're in the public. There is a surge, and there is a new vaccine we learned that's coming out, and it'll be out in September, and we encourage many people to get it.
Great. So this question is about whether or not you can ask your physician to look up a prescribed medicine in the PDR, the physician's desk reference, for general information about a medicine as well as the possible side effects. And I would say, well, I hope you don't have to ask your doctor to look up something in the PDR, but I think sometimes it's incumbent upon ourselves to learn about what we're taking. So generally, I can say this, and Dr. Newell, if you want to add to it, but most drug manufacturers have information about their drugs on their website that you can look up. Also, there's the package insert that has information, like all the information you would ever want and need to know about the drug. But I don't know, Dr. Newell, if you want to add to that.
I completely agree. There's so much information. And let me tell you about the PDR. The issue with the PDR and side effects is my understanding when I was a younger physician, if anybody has one symptom reported to the PDR, it gets written in there. So if one person reports that they vomited after taking X, vomiting will be a side effect of that medication. So it's not like those side effects in there are, you have to have it with 2,000 people. So pretty much nausea, vomiting, abdominal pain is a side effect of absolutely every single medication known to man. But I don't think you need to ask it out. Generally, as a physician, we know what the common side effects are. So we're going to generally tell you that when the medication is prescribed. And if the doctor doesn't tell you what the side effects are, you should ask them.
Yeah, you can also talk to the pharmacist when you get the prescription.
That's true.
So,
That's
yes.
true.
Great.
Excellent.
Yeah. Next question is, what would you think constitutes a reason to send a formal complaint about a provider and healthcare plan? I'm adding that, but the question is about the provider specifically.
Well, I think that if you feel that things have been missed, if you feel that someone prescribed for you and they never examined you, that would be a reason. I'll give you guys an example. I had a situation, I may have told you this already, but I went in to see a medical provider when I had a terrible, terrible, terrible cold last year, and it wasn't COVID. And I had treated myself with everything that I could, that was over the counter. And I saw a provider, and I think, she may have been relatively new in the business. And she ordered a chest x-ray on me and just said, I'm ordering a chest x-ray, and, we'll let you know about the chest x-ray. I mean, I wasn't even ordered Tylenol. I mean, Robitussin. I mean, nothing was ordered. And not only that, I didn't even get a call back from the provider to say your chest x-ray is negative. Of course, I saw it in my portal, but I sort of thought there would have been, this is in an urgent care setting, okay, not my primary. So I called and registered a concern that I had gone in for help, and I just didn't feel like I had gotten any. And so then they put me on with a physician assistant who then took more history and basically asked me, what I wanted. What did I feel that I needed? And because I'm a physician, I could call for what I needed. And I just recommended, I think I need this cough medicine, but that's not the way it should be. So I didn't register a written formal complaint, but at least I got some, what do you call it, comfort meds to relieve my cough and, whatever else I was. So that's one thing. The other time you can register a complaint is that if you go to one doctor and they do one set of things and you go to somebody else and something's missed. You really want, it's not a matter of just suing. You just kind of want that doctor to know you don't want to do this to somebody else. If somebody comes in with this problem, you need to know to do this, that, and the other. So, it's not something that you jump and run to often, but it needs to be something fairly significant. Most people just say, oh, I don't like that person, and they walk away. But you want to think about it and process it. And, you want to have some concrete evidence to indicate why, or if somebody's rude to you, or if somebody calls you out of your name, or, all those patient rights, were you not respected? Were you discriminated against? Was your information breached to, your neighbor because they worked in the same office?
Well, I'm glad you brought up the discrimination, because I was actually going to try to connect the dots here a little bit. Is in the context of the Listening to Black Californians research and also the How Do I campaign, at least based on the research, we know that one of the findings was that about 1 out of 3 Black Californians report being discriminated against. And so I was going to ask you a question when we talk about communicating with a healthcare provider. So one, you can file a complaint in that situation, but if you're in that moment, how would you recommend someone communicate with their healthcare provider to mitigate that situation or to, navigate through that?
That's a great question. That's probably a coaching session that we need to role play with. But, there are things that you could say, like, is this what you recommend only for your African American patients? I mean, it's being very direct.
Right.
But is this what you would recommend for any patient, or is this just what you recommend for your African American patients? I mean, sometimes we just have to call it what it is.
Right.
And when doctors make comments like, inappropriate comments, then we call them out on the inappropriate comments. Well, I'm offended by the fact that you feel that, you know, my church goes on for 6 hours on a Sunday. It's you know, it's hard. I'm trying to come up with some.
Okay, yeah.
I've probably been discriminated against and just been so oblivious to it that I just walked out, because I generally, try to ask for what I need. And, quite frankly, I try to get doctors that look like me. That's what I
Right.
try to try to avoid it, but you can't all the time.
Always do
So
that,
I
yes.
think it's hard to give someone a specific answer on that. Every case is very individual, but best I could do for giving just a blind example.
Yeah, thank you. So what is the best way to approach your doctor with clinical trial opportunities, or to ask questions about whether or not that could be an option for someone who is facing a certain type of health condition?
Oh, yeah, that's a great question. Well, they're trying to get more and more of us into clinical trials. I think you just ask your doctor, are you familiar with clinical trials of new ways of treatment for this condition? And if they don't, they should be able to refer you to someone. And I will tell you, the teaching center that is the Mecca, as far as I'm concerned, is UCSF. So they should be directing you there or perhaps to Stanford. Many doctors won't have that in their armamentarium. They just won't know where the clinical trials are taking place. Or if they don't know, there may be someone in the practice that has that expertise. So you just ask the doctor about that. In particular, in oncology, they may be a little bit more knowledgeable. But in teaching centers is where that usually happens. So it likely will be a connection to UCSF or Stanford.
Okay, and then I believe there's also a website through the National Institute of Health where you can go and see all the current clinical trials that are underway. Is that correct?
I think you're right about that. I actually have a colleague that is big on clinical trials. He works now for the Mayo. He was working for CVS Pharmacy. I could reach out, separately, Rhonda, and ask him if there is a resource and maybe make that available to California Black Health Network for someone. Oh, somebody put something in the chat. So maybe I don't know, what is that?
I can't read that, but it's from Monica Washington. Maybe Astrid, you can read what she just said. The font's really small for me.
Yeah, she put a link in the chat. I'm gonna click on it to see. It takes it says that site cannot be reached when we click on it. So if you want to,
but we'll make sure we get the proper resource to everyone as a follow-up, along with your communication tips as well. So the last question is about when you talked about your sister working together with your parents' health. It sounded like you both were on the same page with how their care would be addressed. What happens when the caretakers don't agree? And how can this be addressed so that the provider knows who to listen to? Tough question.
That's a tough question, but I will tell you this, and I say this over and over, no matter where I go, you have to primarily pick one spokesperson. The doctor does not have the time or energy to deal with all 8 kids. We just don't have the time. And you're going to get a different story every time. So the family must come together for the sake of the loved one and pick a spokesperson. The other thing that my sister and I do is we agree that if she can get to the phone before I can get to the phone, that I honor whatever she has requested, because both of us can't always get there at the right time. So you have to have that trust that whoever that family member is that they're going to be doing the right thing by the family. And we always got one family member that's not kind of in line with everybody else. You might just say to the doctor, and if you get calls from Johnny, just thank you, but ignore them, because Mary and I are the primary people. So I don't know how to encourage everyone to get their family straight, but understand we all got family. That's what we have. Those are the people that are born in. But do your best, because at the end of the day, it's all for the sake of the person that you love and care for. You can have your differences, but try to figure out a way to come together for mom or dad.
Great thing. I like, there is one more question. This will have to be the last question just because it's where I am is 4:15, but 1:15 Pacific time. And so this person says that they decided not to take advantage of a drug therapy where genetic testing for the drug was required. That person later changed their mind, and the genetic test revealed not only that they did not have the disorder for the majority of her life, but also thought that they had to but the lab wanted me to donate my blood and pay for me to do so. How do you feel about genetic testing and privacy?
You know, it's very much a personal thing. I think that when these types of questions come up, it's important to have a conversation. I think it's very, very hard for somebody to drop something in your chat. I actually had this happen. Dropping it into, and they're asking you to donate your this or your that, and you don't know where it's going, and you don't know how it's being used. And I think that's a disadvantage to the people that are doing it. And so I think they're going to get a lot of no's. So I have to say to you, I think you have to follow your gut. I think most of us believe that if I can donate my blood to help save somebody else, and this research is going to help, I think most people are willing to do that. But the problem is we don't know what's going on behind the curtain. And when this information is shared just through email and text, and you don't know where it's going or what part of your information is being revealed, then the people on the other end are the ones that are losing. I want to say you just have to be comfortable with it. So if there's a way that your doctor can help you get to the people that have sent you the email and you care, try to arrange to have a conversation with the person that's raised the question so that you feel comfortable. Otherwise, most all of us may say, I'm not sure about that. We think about Tuskegee and we say no.
Right. Okay. Well, thank you so much, Dr. Glenda. I really appreciate your time, your wisdom and knowledge, and sharing some key tips about how we all can communicate more effectively with our healthcare provider as well as our healthcare team. So I just want to wrap things up here. And the most important thing to share first is that we want to hear back from you. What do you think about the session today? And also, Dr. Glenda, we know she's amazing, but we would love to get your official feedback. So if you can take a moment and scan the QR code here and complete the survey, we would greatly appreciate your feedback. You know, this is information that we need to know how we're doing so that we can continuously improve what we're offering to the community. And also the Healthcare Foundation, the California Healthcare Foundation wants to know how you feel about what you learned today and the session experience. So again, please take a moment to scan this. We will send a follow-up as well for those who had to leave early today, but happy to see there's still 70 people that have hung around to hear Dr. Glenda respond to all the questions that were in the Q&A box. And so just moving right along, just a reminder about some upcoming events that we're having. There are a couple of community events. They both are, well, actually one's related to the How Do I campaign. One is a membership event. So on August the 9th, we have, which is tomorrow, can't believe the week is almost over, but we have from 3:30 to 6:30 in Stockton, a community conversation series that is really focused on recognizing breastfeeding week this week. This is Breastfeeding Awareness Month, and specifically this is for Black Breastfeeding Week recognition. So if you haven't registered and you live in the Stockton area, you can go to our website on the events page to register there. On August 29th, we have our very first in-person member networking event in Fresno. That information to register is also on the website on the current events page. And then the next How Do I session featuring Dr. Glenda is on September 19th, and that is how to navigate through the healthcare system, which we know is very complex. And so it'll be great to hear from the provider side how we do that so that we ensure that we get the care that we need and deserve. And just a reminder also to connect with us so you can keep up with what we're doing. If you're not on our mailing list, you can join to get emails about the events that we're having and other information that we're sharing with the community. You can follow us and connect with us on social. It's pretty easy to remember. It's at your CBHN, except for X, and also actually X should be your CBHN, and the LinkedIn is California Black Health Network. And also join us in supporting the Campaign for Black Health Equity. We are a nonprofit organization, so supporting us is how we're able to do this work and bring this work to the community. So I want to take a moment to say thank you for joining us today. We look forward to seeing you on the 19th of September for the next session in this series. and hopefully other events we're hosting in between. So if you have any questions about today's session, you can always reach out to CBHN at info@cablackhealthnetwork.org. Thank you, Dr. Glenda. Again, thank you for the team providing the background support, and we will see you next time. Have a great weekend.